What's going on, everyone? Happy Saturday once again. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Virus Update for Saturday, October 5th, 2024. If you're new to my channel, this is where I do the daily virus update and sometimes other videos as well. If you were here this morning, you saw I did do a video this morning and said, well, that was going to be the video for today. Well, I came home, had a look at the news, did my searches, and said, whoa, wait a second. There's a lot of things going on today. We need to do an edition of the virus update. Here we are. What's the virus update? We talk about all the different viruses: COVID, H5N1, flu, measles, norovirus, all these different viruses that could be a health threat to you. However, we put the most attention here on this channel to the COVID virus. Why? Because the COVID virus has wrecked so many lives. It has taken so many lives over the last several years, and it's a virus that continues to be in pandemic mode. Long COVID is a pandemic of its own, and the COVID virus itself is still killing people. So it's something that needs attention, which is why we do these videos all the time. So if you're new to my channel, welcome aboard. Subscribe down below. If you like this video, give it a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. Alrighty, we actually have a ton of things to get through today for a Saturday edition of this video. We may take a look at those ER visits diagnosed with COVID, like we do state by state for all the states that are reported. We may not. It depends. Like I said, we got a lot to get through. First off, there has been a breaking news story that has popped up this afternoon. A Saturday news drop on H5N1 from California. California now reports another human case of H5N1 bird flu. That's the third case in just 1 week. And get this, all three cases are unrelated to each other. They're not connected in any way, shape, or form. First tests were positive. CDC is doing the final testing. This is an evolving story. We've been seeing H5N1. There was a lot of news about it back in the spring. Less news in the summertime. I mean, a few outbreaks in dairy farms here and there throughout the summer. But now it's ramping back up again, and we're seeing human cases starting to increase, which is not a good thing. All right, moving on now to our next thing that we need to take a look at. Italy. Italy has updated, and it's not good news out of Italy. This is for COVID now. Italy's COVID cases are on the rise, and if we take a look here, this was posted on October 4th on X, we can see here the COVID cases in Italy. They recorded 13,073. That is up from the previous week, which was 11,163. Patients in the ICU, 73 versus 62. So that is increasing. Patients in the hospital, they now have 2,067 versus 1,885. That number continues to rise. Deaths have dropped a little bit. Remember, deaths lag everything else. So if there's going to be an increase in deaths, it may be a few more weeks before we see that start to occur. And they did have, in the past week, 85 versus 112 the previous week. The positivity rate in Italy, that is rising as well. It is now up to 13.8%. And the case fatality rate at this point, CFR, I'm assuming that's what it means, is at 0.7%. Real quickly, we got to go back to this other story, H5N1. I did make a tweet on Twitter just recently. If anyone knows what the full total count is for H5N1 here in the United States for so far this year, unfortunately, I have not been keeping a track of that. I've lost count. Please let me know in the comments down below, and I'll see if I have any comments with an answer to that over on X. All right. Moving on now to our next story. This is something else that's new today. Health concerns rise at Disney. Visitors claim to catch worse illness you can imagine at Walt Disney World. And this is not good whatsoever. First off, here's how the article starts. If you're heading to Walt Disney World, while there are many things to think about, and making sure you have some vitamin C packed is seemingly one of the new ones. Yeah, just packing vitamin C, it's going to prevent you from getting sick. No, we all know what's going to prevent you from getting sick. I'll show it to you. It's these things right here. Mask. Or better yet, why go to Disney when we're still in the middle of a pandemic? They do talk about COVID here several times. Then if you come down here to this, I thought this was really interesting. So a person said, I used to visit fairly often and was usually fine. Of course, still some sick days, but it was a rare and avoidable as long as you just wash your hands and all that. Yeah, wash your hands. You'll be fine. But here's what it says next. Then I stopped going for a few years and just recently started again. Been here 4 times in the past couple of years, and every single time, basically immediately, I got the worst illness you can imagine. This recent trip, it was the second day of the trip, and I already felt it coming on. Then, the third day came, and I was done. Completely sick with whatever it even is, and that was it for the whole rest of the week. Pretty much wasted all but one ticket. I got a solid 1.5 days worth of being able to go to the parks. Hello, if you're getting sick every time, why do you keep going back and putting yourself, I really hate to use this word, excuse my language, why do you keep going back and putting yourself through this hell that it seems to be? And then they said, like I said, this has happened every visit in the past couple of years. It probably seems insane that I even keep trying, but I don't know. I just keep hoping it'll be different because I really want to go. At least the other 3 times I was here for 2 weeks, so I was able to recover and go back again, but this time I was only here for a week. It was just entirely ruined. We're not going to read anymore. You get the point. People are getting sick when they go to Disney World. Hey, Florida, America's virus trap. Yes, Florida is America's virus trap. There's a lot of virus issues down in Florida. All right, moving on to this. There seems to be some issues at Vassar College. It says Vassar students express concerns over college COVID-19 protocols. And let's come down to what I have highlighted here. The Vassar Health Services frequently asked questions page directs students to wear a mask and begin self-isolation if they test positive for COVID, reiterating the CDC's current guidelines. However, in an email, it clearly stated that any period of isolation was, quote, optional, and added, if you test positive for any respiratory illness, you may be recommended to self-isolate in your assigned room based on the severity of your symptoms and any underlying conditions. Again, quote, recommended and, quote, optional. It's not even mandatory to isolate if you test positive for COVID. So, say you share a class with someone who is high risk. Well, guess what? If say you're the person who's high risk, if someone else has COVID, they have the ability to go to class if they want to because it is only optional for them to isolate. Totally ridiculous policy. Totally ridiculous whatsoever. And a number of students, I've read this whole article, a number of students say they have been told mixed stories. You want to read this full story, I tweeted it out, and I am going to be making a thread today for all of these news stories because we're not done. We got more. Moving on to this now. COVID-19 hospitalization remains higher among older adults. So it looks like the older adults are the ones that continue to be hospitalized for COVID at a much higher rate. But yet, masking guidelines are no longer mandated in healthcare facilities. We talked all about that this morning, but I'm going to add something else that I did not mention this morning, and that was long-term care facilities, hospitals, and more so nursing homes. I think staff should be just required to mask in nursing homes. Their age groups that they work with get hospitalized at higher rates. This continues to be a problem despite vaccination. Vaccination works great, but it does not prevent all severe cases, so this continues to be problematic. I mean, Something so simple seems to be so hard for many people to do. All right, moving on to this. SARS-CoV-2 damages kids' bodies. 16.2% of pediatric participants experience one or more persistent symptoms at least 3 months post-COVID. And you can see here on the chart, from top to bottom, it shows the most to the least common symptoms. And we're just going to take a look at just a few of them. Sore throat. Look at that. That seems to be the top of the list. Persistent fever. Sleep disturbance. Okay. Sleep disturbances. Fatigue. Muscle weakness. Cough. Headache. I just listed quite a few things here. Things that are pretty serious. That would impact one's ability to get a proper education. I mean, you have a constant sore throat, persistent fever, you're not getting good sleep, fatigue, muscle weakness, cough, headaches, abdominal pain, diarrhea, nasal congestion. Imagine being forced to go to school while dealing with all these problems. And then they wonder why the grades are down. They're saying, well, it's because schools were closed and they missed that time with education. No, hello. Take a look at these issues that are going on in kids. These issues that are going on post-COVID. Meanwhile, kids are being forced into schools with no ventilation. I got an air purifier behind me. A lot of schools don't have that. Maskless, and guess what? They just keep getting infected again and again and again, and more kids deal with these issues, and some who already have these issues are being infected again, and these issues are becoming worse. How can you get a proper education when you have to deal with all these issues? And I mean, we could go on here to many other things. Oh, here's one. Weight loss. Yeah, kids dealing with weight loss, that's not good. Kids are supposed to be growing. They're getting tall, their arms get longer, all these things. That's pretty bad. A skin rash is listed on there as well. So your, child's trying to get educated in school and he's constantly itching because he's dealing with a skin rash. And, a lot of these things that I just mentioned are bad enough that the kid can't even go to school because they're dealing with all these different problems. And we just only talked about a few of them on here. All right, moving on. We do have another thing to share with in the news category. Not really a news, a poll I took. Speaking of long COVID, are you or someone you know dealing with long COVID? 235 votes, not the biggest amount of votes we've ever had, not the smallest, but hey, 72.8% said yes, and I'm pretty sure we've asked this question before. From time to time, I like to repeat questions to see where we stand going along the way. 27.2% said no. That's out of 235 votes. So people are dealing with long COVID, and they know of people who are dealing with long COVID. All right, national allergy map. 49% of the country is in low to medium status. And I do need to actually refresh this. It's 46% of the country. And the worst is in the southern states. Air qualities for today, we do have some problematic areas, and that does continue to be the West Coast, which is not doing well. You'll see when it comes up. There we go. And portions of the Rocky Mountains, Wyoming, Montana, Idaho, yep. And take a look at the plains. We're dealing with a lot of yellow there as well. All right. Speaking of air qualities, we also need to take a look at weather. Yes, we have to include a little weather segment today. We do have a problem. That problem has a name. It is Tropical Storm Milton, which has formed in the Gulf of Mexico. It was just named TD11 this morning. Now Tropical Storm Milton. And I would not be surprised if by tomorrow's virus update, we're talking about Hurricane Milton. This is evolving relatively quick, and it is looking like, that's not the correct storm. It is looking like this is going to be problematic for Florida. Yeah, unfortunately, I think we're going to be talking about another hurricane, maybe even a major hurricane for Florida. Here's the latest track for the National Hurricane Center. It is expected to continue to develop. It is expected to be a hurricane at landfall on Wednesday at around sometime midday Wednesday. Will landfall on the western shore of the Gulf Coast of Florida, and there is possibility this could become a major hurricane. There are several models that have already gone up to major hurricane status. I will be watching this closely, and I'll be tweeting about this frequently over on my other X account, that is Climate Data Report. Pay close attention to that throughout this weekend. All right, moving on. Philadelphia yesterday, 882 EMS calls were reported. That's a really high number, and I honestly Don't know why it was so high yesterday. It was not really a bad air quality day. I don't know. Is it long COVID? I'm thinking long COVID is just through the roof right now from this summer. I'm thinking there are so many people that are having new health problems. Again, that LabCorp this morning, there were like 20 to 30 people there. Are people going to get blood tests because they're have to go see a specialist? They need to see their doctor because something's just not right ever since they had a summer COVID infection? I don't know. Montgomery County today reports it's not that busy right now. 7 EMS calls. Was busier earlier. Chester County is going to look worse than it actually is. There's a lot of EMS standby calls right now. 1, 2, 3. I'm seeing 4 of them. But you know what? I take that back. There's actually a lot of things going on there right now. Heart problems is listed a few times. Sick person, injured person, falls, several falls calls, respiratory problems. So yeah, there are calls to be had in Chester County, Pennsylvania right now. Let's jump over to New Jersey hospitalizations, and I believe the number for today in New Jersey, as this does eventually load, I believe it's 399, and it says that is with 70 out of 70 hospitals reporting today, which is something we don't usually see on a Saturday. On a ventilator, 9. In the ICU at this time, 36. And discharges at this time, 63 discharges in the last 24 hours. Alright, let's take a look at the latest variant of COVID. It is the KP 3.1.1 variant at 58.7%. XEC at 6%. And XEC is a up and coming variant that could eventually take over altogether. Alrighty, continuing on here. As I said, if we have time, we will get to the percentage of emergency department visits diagnosed with COVID in all regions of the United States. If we don't have time, we'll get to it tomorrow. I think there will be a video tomorrow. We're going to take a look at some wastewater tomorrow, which we haven't done enough of this week. Alright, I have a lot of things in my notes today. Saturday's virus update. First off for today's update, I have to remind you, postseason baseball. While wildcard games have started, we're now moving on into the division series. I believe it's the division series games. Hey, we got a game here in Philadelphia today. Notice I'm wearing red to support my Phillies. But at the same time, as much as I support them, and as much as you probably support your teams, there's going to be a lot of people that go out and patronize in businesses. So bars and places could be crowded, not just because of baseball. It's fall football as well. That could help spread COVID and other viruses. Even though COVID levels are dropping in the United States, they are. COVID levels are dropping. Your risk of catching COVID, it still runs high right now. Any large gathering setting, you could catch COVID and other viruses. They're starting to increase. We're seeing the early stages of that, and you could get a case of RSV, flu, other things as well. Leaf peeping up in the north is becoming a big thing. New England, I looked at the traffic map just a little bit, and it's crowded up there. And Columbus Day, or I should say Indigenous People Day, weekend, is coming up relatively soon. That's a big spreader for it's a big thing for leaf peeping, and that can potentially be a spreader for these viruses as well, and that could be really what gets the ball going for flu and RSV. Alright, now some data from CJS 83172. He did provide us with quite a bit, so bear with me here. It's a lot of stuff to get through. First off, daily weekday reporting states. Florida, 619 new cases and 58 new deaths in today's update, meaning yesterday. And for the week, they had 3,932 new cases. And get this, 156 deaths over the past 7 days. That may sound like a high number. It still is. But that number is coming down. And you're going to see as we go along here, I think when BNO updates tomorrow night, I think BNO's update for this week is going to be lower. New Jersey, 356 new cases and 1 new death yesterday. 3,111 cases for the week and 12 deaths for the week. New York had 1,206 new cases yesterday and 9,025 cases and 51 deaths reported this week. Virginia, 437 new cases and 1 new death today with, get this, meaning yesterday, and 3,784 cases and 44 deaths added to their open data page, with 39 of those deaths being reported in a Tuesday dump. Puerto Rico had 226 new cases and 1 new death yesterday. and 1,592 cases and 4 deaths reported over the past 7 days. Weekly reporting states: Alabama, 19 new CDC reported deaths; California, 3,675 new positive tests and 89 new deaths, their first week under 100 in a couple of months; Georgia, 1,830 new cases and 33 new deaths, a wave high; Idaho, 472 new emergency department visits; Louisiana, 777 new emergency department visits and 14 deaths; Missouri, 29 new CDC reported deaths for the third consecutive week; Mississippi, 11 new CDC reported deaths; Pennsylvania, wow, this is a lot of hospitalizations for my home state that I currently live in. 700 new CDC reported hospitalizations and 54 new deaths. So in other words, 700 more people in my state went to the hospital for COVID. Yeah, that's still a pandemic. South Carolina, 26 new CDC reported deaths. Texas, 2,524 new cases and 43 new state reported deaths, with the CDC number being a bit higher. Wisconsin, 15 new CDC reported deaths and a test case positivity rate of 11% this week. West Virginia, 1,464 new positive tests and 9 CDC reported deaths. All right, thank you very much to CJS 83172 for those numbers. And that does it for the Saturday edition of the Virus Update. A very busy one indeed. As you see, we have gone over 21 minutes. If you learned anything, if you like this video, give it a thumbs up. If you're new here and you feel like, wow, these videos really keep me informed with what's going on. This is really, why is the news not reporting on this? Well, they're not, but I am. I'm piling everything I can find together into one video. So subscribe down below if you're new, give this a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. We will have another video again tomorrow with wastewater, and we'll take a look at those emergency department visits. And based on the way this weekend's going, I'm pretty sure there are going to be more news stories that come out. It's just insane. Thanks for watching. I'll see you all again next time. Have a fantastic but safe Saturday afternoon. Bye for now.